How do you check new moles for skin cancer? Have you ever noticed a new mole on your skin and wondered if it could be a sign of skin cancer? Checking new moles is crucial for early detection, especially for melanoma, the most serious type of skin cancer. One effective way to evaluate moles is by using the ABCDE rule. This rule helps you identify warning signs that could indicate a problem. First, let's talk about asymmetry. If you draw a line through the middle of the mole, does one half look different from the other? If so, that could be a red flag. Next, consider the border. Healthy moles usually have smooth, even edges. If the edges are irregular, scalloped, or poorly defined, it might be worth a closer look. Now let's move on to color. A mole that has multiple colors or uneven shades, such as tan, brown, black, white, red, or blue, could be concerning. The diameter is another important factor. If the mole is larger than 6 millimeters, which is about the size of a pencil eraser, it's time to pay attention. However, remember that melanomas can sometimes be smaller than this. The last part of the ABCDE rule is evolving. If the mole is changing in size, shape, color, or any other characteristic over time, that's a sign you should not ignore. In addition to these criteria, keep an eye out for other changes. If a mole starts to bleed, itch, crust, or feels different to the touch, it could indicate a problem. Another helpful concept is the ugly duckling sign. This means if a mole looks noticeably different from other moles on your body, it may need further evaluation. When you check your skin, don't forget to look at areas that are not often exposed to the sun. This includes your scalp, between your fingers and toes, under your nails, and the soles of your feet. If you have darker skin, be aware that melanoma can appear in less typical places and may not show classic signs. It might be symmetrical, pink, or even located under your nails or on your palms and soles. If you notice any new mole or spot that looks suspicious or different from your other moles, it is essential to see a healthcare professional promptly. A dermatologist or primary care provider can perform a thorough skin exam. They may use a dermatoscope, which is a magnifying device, to assess the mole more closely. If the mole appears suspicious, a biopsy may be necessary. This involves removing a sample or the entire mole for microscopic examination. There are different types of biopsies, including excisional biopsy, which removes the whole mole and some surrounding skin, and punch biopsy, which takes a small, deeper sample. Regular self-exams combined with professional skin checks are key for early detection. Early-stage melanoma is highly treatable. If you cannot see a doctor right away, consider taking close-up photos of the mole over time to track any changes. In summary, checking new moles involves a systematic approach using the ABCDE criteria and being aware of any unusual features. If you spot something concerning, timely professional evaluation and possible biopsy are essential steps. This proactive approach supports maintaining healthy skin and aids in the early identification of skin cancer.